Sylvia Bradford lives in Whitby, North Yorkshire. She accesses support delivered by a new fast response team in the area run by North Yorkshire and York Primary Care Trust. Through this team, Sylvia can access a range of healthcare support, which means that after a spell in hospital, she's been able to return home more quickly than would otherwise have been the case.
I went into James Cook Hospital at Middlesbrough for a total knee replacement. I had an operation and when I came home, fast response dealt with me here.
This service is for patients who are medically stable but who need care support or therapy. In the past, this level of care may only have been available in hospital. But the fast response team can deliver high levels of care to patients in their own homes. A full assessment of the patient is carried out, so an individual care plan can be developed to meet the patient's needs.
So if you were wanting to get that sort of nice piece of quiche Lorraine out and lift it out, would you be able to reach it out, or how would you go about it?
Well, I can come again, because getting things out of that fridge and things is awkward.
Yeah, it's just
I wonder if we can think of a way of doing that.
Sylvia is one of a number of patients currently being supported by the Whitby Fast Response team. So after the assessment, it's back to the team's base at Whitby Hospital to discuss other referrals. Nurses, physiotherapists, occupational therapists and support workers all contribute to this integrated service, with each patient receiving care from the services they need.
And so I've passed that on to Claire, who's going to arrange for it to be taken away.
The main problem that we've come across since we've been going in is this gentleman's not keen on having the equipment in his head.
No, he won't use the pressure cushion. He said it's too uncomfortable.
Possibly. We could show him one and see
the
if he
problem
likes
is him getting up though. He can't actually manage to get up that well, so he's using the toilet. The toilet seat is the sink and the towel rail, and he's just grabbing at anything to get up.
There are also strong links with other organisations, such as local authority social services, to make sure patients can receive all of the care support they need at home where this is clinically appropriate.
Our role is to support and enable people to remain at home and live as independently and as dignified as they can within the limitations. We have very specific criteria in which we have to assess and implement a support package to a person, and once they've been home, with the services that they've been having from the fast response team, we've been able to link in maybe 2 or 3 weeks after their discharge, which is actually looked at their needs in a more holistic manner as opposed to just focusing on the medical needs.
Dr. Rory Newman is a GP in Slights. He's referred a number of patients to the Whitby Fast Response team.
One of the problems we've had for a lot of years is that while social services are very good and will put services in to help people, they're not in a position to do it quickly. For example, there's a gentleman that I saw yesterday who has developed acute vertigo. He's become extremely dizzy. Now, this is giving him great difficulty in getting out of bed, reaching the toilet. Under normal circumstances, I would have had to admit him to hospital. Instead, I rang the fast response team, in they went, sorted him out, he's still at home.
After the assessment to work out which services will help Sylvia, a healthcare assistant is on hand to offer general support.
Do you want to have a go at getting out of the chair while I'm here?
And this is a worse spot for getting out of me.
Well done, almost there, nice and straight. So you've got confidence still after your fall yesterday, aren't you?
Yes,
People don't want to be in hospital if they don't need to be. From the patient's point of view, it maintains them at home, which is where they want to be. From my point of view, I prefer to look after people at home if I can. It's good for my budget, and it's obviously good for the PCT as well, because they're trying to avoid admissions if they can, to win her all round.